All right, hey, those of you with prediabetes or type 2 diabetes, how can you quickly normalize your glucose levels, your A1C? Here's the secret. You gotta get moving, build your muscle. That's the first thing you can do. Type 2 diabetes or prediabetes is a very difficult disease to understand. A lot of people will say you need to cut out glucose, reduce your carbohydrates, and that is only one tool. You have to have a better understanding about the metabolism or the breakdown of carbohydrates and glucose to fully understand how to treat the disease. If there's one thing that you should do if you're having some prediabetes or type 2 diabetes already diagnosed and you want to put it into what I call remission, or you want to get rid of it completely or normalize A1C to be more scientific, then you gotta start moving your muscle, building muscle, get in the gym. You gotta, and if you're at a point where you're like, I'm not a gym person, I'm not gonna go in, okay, start doing some squats. If you're a gamer, play physical games like maybe Beat Saber or some of these dancing games, but you got to get the body moving if you want to self-treat and reduce those glucose levels in your blood. The worst thing you can do is starve yourself of carbohydrates. That will temporarily lower your glucose levels, but then you will lose muscle mass. For more information, make sure you meet with someone that actually knows what they're doing with this disease. And if you're doing it on your own, start moving. You still need to eat carbohydrates, but you probably need professional guidance. Reach out to me if you're in Texas. I don't have a license yet in other states, but if I do, then you could eventually, I'll open up services over there. Hope that helps. That's your 2 minutes for the treatment of type 2 diabetes and pre-diabetes. Remember, this does not pertain to type 1 diabetes. That's a little bit more complex. Maybe I'll do another video on that. Toby Doc out.